Before, we didn't seem to see that many kids with nearsightedness. Half of the global population is going to be nearsighted. So there you go. It's the screens. When the eye is constantly focusing up close, we found an association with nearsightedness, needing glasses to see far away. Now, 20 years later, the average age of nearsightedness is 8. Now, screens affect kids in a lot of different ways. Screens and nearsightedness is something that's relatively new, but once you get to 4 hours a day, that increases their risk by 91%. And every hour on top of that increases it by another 21%. So what can we do about it? Welcome to In Focus. I'm your host, Dr. Rupa Wong, board-certified pediatric ophthalmologist, and today's episode is why your child's eyes matter. We're discussing screen time, nearsightedness, and everything in between. But before we start, I wanted to talk a little bit about my why this particular topic and why vision care in kids is important to me. I have 3 children, and I am able to treat these kids for nearsightedness prevention, just like I do many of my patients. And when I discuss nearsightedness, it's something I want to bring a lot of clarity to, just like any of the other eye health topics that I discuss on here. I don't think that education should be restricted to the exam rooms with a doctor. I think every single person should feel empowered to make the right choices for their families, for their children, and to know confidently that they are doing the best that they can for their kids. So I want to empower you to share with you what I wish every parent knew. I never want a parent to come to me in the exam room and say, oh, I wish I had known that this treatment exists. I wish I had known that this would be of benefit. That's my goal with this podcast, and specifically this topic, which is so pertinent in today's society, in the online world we're all living in. Right now, parenting is so much harder than it ever used to be. We have a constant flood of information coming towards us, whether from social media or very well-meaning friends and family members telling you all the old wives' tales about what's important for your eyes or your children's eyes, all those vision care myths. And it's difficult to discern what is true and what's not. We live in a very information overloaded society, and as a parent who's extremely busy, that can be challenging to navigate what's true and what's not true, especially when it comes to screens. Vision and screens is something that's come to the forefront of topics nowadays because we're living in a digital world, and it's truly impacting the way that kids see and what's happening to their eyes. So first, let's just start off. What is nearsightedness? What's myopia? Why do I even care? It's not something that requires surgery. It might not seem as if it's that important. Isn't all you need a pair of glasses to correct a child's nearsightedness? Well, here's the thing. Nearsightedness actually has to do with how long the eyeball is. So when someone is nearsighted, that means they can't see things far away, but things up close are relatively clear. Unless, of course, the vision is really high in terms of the myopia. Then even the up close things can be blurry as well. But it's not just about whether or not you need a pair of glasses. That doesn't really interest me as much as you might think. What I'm really interested in is preventing any of the vision-threatening eye consequences that happen when a child or an adult becomes nearsighted. So when you have an eyeball that's nearsighted, that typically means the eye is longer than a normal eye. And we can measure that with something called the axial length. Think about it like a balloon, and you're inflating the balloon with air, and then you're putting in a little extra air. It stretches that material of the balloon a little more thin. That's basically what's going on with your eyeball when you're nearsighted. Your eye is stretched a little bit more thin. The retina, the inner lining of the eye, that's basically the camera film of the eye, is getting stretched a little more thin. And with that comes possible vision-threatening complications. So you've got retinal detachments. That's when there can be a break in the retina that causes fluid to escape underneath. Again, caused by that thinning of that balloon, thinning of the retina. This can also cause an increased risk of cataracts, of glaucoma, and something called myopic maculopathy. These are all vision-threatening eye consequences. And that's not something a lot of parents think about when they're giving their child their first pair of glasses. There's concern usually about, oh, my child can't see. I didn't know that they couldn't see. But usually parents aren't thinking, what does this mean down the road? And these are the things I'm hoping to prevent with really addressing the causes for nearsightedness and now employing treatments that can slow that progression of nearsightedness in kids. Why do we have this epidemic of myopia? Before, we didn't seem to see that many kids with nearsightedness, and it's truly increased in just a generation. It's predicted by the year 2050, half of the global population is going to be nearsighted. So what's changed? Well, I bet you know what's changed. It's the way that we live our lives, these modifiable lifestyle risk factors. Kids are spending less time outdoors and more time indoors and more time doing up-close work, even on screens. So there you go. It's the screens. Not only the screens, but screens, reading, writing, even coloring, all of those things combined, that's what constitutes near work. And when the eye is constantly focusing up close, we found an association with nearsightedness, needing glasses to see far away. We found now that even kids that were diagnosed with nearsightedness 20 years ago, the average age of onset was 11. So an 11-year-old was getting a first pair of glasses at that time. Now, 20 years later, the average age of nearsightedness is 8. That means kids are getting their first pair of glasses at a younger age. And this is really due to these lifestyle factors. The genetics have stayed the same. The family history has stayed the same. But what has changed is the amount of tutoring kids do, the amount of time that kids are spending on their phones or tablets or laptops, the amount of time that kids are just spending indoors compared to being outdoors. Now, screens affect kids in a lot of different ways, not just with nearsightedness. And we'll be tackling a lot of these issues in upcoming episodes, but screens can cause dry eyes, they can cause blurred vision from that dryness, and it can even mess with the circadian rhythm. So kids that are having more difficulty sleeping at night, or they've got more morning grogginess. All of this has been very well studied. But screens and nearsightedness is something that's relatively new, and a new research study showed every hour that children are on screens actually increases their risk of nearsightedness. There's a safe potential zone of about 1 hour. 1 hour of screen time a day, kids only increase their risk of nearsightedness by 5%, so not too bad. But once you get to 4 hours a day, that increases their risk by 91%. And every hour on top of that increases it by another 21%. So we're finding that screens really are linked to worsening this nearsightedness epidemic that we're seeing across the world, not just in our country. So what can we do about it? Well, of course, you can look at screens and we can start to try to impose some screen time limits. But there are other things that we can do. Now, the genetics, as I said, they've stayed the same. There are a lot of risk factors for nearsightedness that comes from families. My own husband is nearsighted, and he carries with him a lot of risks. Being East Asian is a risk factor. Getting your glasses, if a parent got their glasses at a younger age, that's another risk factor. There's a lot of parental guilt associated with having kids and feeling like they inherited your eyes and that they inherited your bad eyes and that they're just as nearsighted as you are. But there are things that we can actually do, and it's not necessarily 100%. If a child has 0 parents that are nearsighted, they still have a 1 in 4 chance of being nearsighted themselves. If they have one parent that's nearsighted, it increases to a 1 in 3 chance of being nearsighted. And if both parents are nearsighted, there's a 1 in 2 chance that the kids will be nearsighted themselves. It's not 100%. That means there are things that we can do to decrease that chance of becoming nearsighted. And that's what I think is so important for parents to know, because a lot of them are free and a lot of them don't require prescription or any kind of medication or contact lens for you to try. The first one, outdoor time. You've heard me harp on this before, but being outdoors has been shown in so many studies across the world in different ethnicities, from the Inuit population in Alaska to Australia to Israel and Denmark. 2 hours a day of outdoor time has been shown to slow the worsening of nearsightedness in kids. This has also been extensively studied in Asia, where they have a really large percentage of their population that's become nearsighted. 80% of high school seniors in Singapore are nearsighted. So it's a big problem there, and they really are taking it incredibly seriously. So in China, what they've started doing is closing the doors to the school during lunchtime and recess, because a lot of the kids were going back inside and they were studying during their lunch and recess time. They saw the data, they saw how important getting outdoors was, and they've become something that's mandated now, even at the public health level. So super simple and free. Now, of course, I live in Hawaii, so I can make this happen year round. And for people that have some colder climates that they need to balance that out, even if it's cloudy, even if it's overcast, that outdoor time is beneficial at slowing that worsening of the nearsightedness. And what do I mean by that? Every year, if you wear glasses, you probably remember going to the eye doctor every single year, that glasses prescription got worse, right? Well, that's that progression of nearsightedness. And usually parents would ask me, oh, what vitamins can I give my child? What can they do eye exercise wise or diet wise? There's really nothing like that that can slow that progression. But outdoor time absolutely can, and it's free. So it's a therapy that I really recommend to absolutely every single parent, whether or not their child is nearsighted. There's just so many benefits of being outdoors anyway. They've shown it improves mental health for children. They've shown that it increases their physical activity and decreases obesity. So a lot of other side benefits of it, but in addition to the eyes. Now, there's also other treatments if we can decrease the near work that kids are doing. And this is hard because I have 3 kids. They are all given computers for school starting in middle school, and in elementary their school gives them an iPad to use for all of their projects and for their learning. So it's really difficult when a lot of the schools have become extremely digital. So what you are then left to do is to decrease their recreational screen time as much as possible, just instituting limits and being extremely just cognizant and knowledgeable that, hey, this impacts my child. Now, I don't want any guilt on this front because you got to do what you got to do. A lot of parents have to give their child a device to be able to get the laundry done or get dinner on the table. And I've completely been there and I understand that. But if at least you're aware of the research and how much it could possibly increase nearsightedness, then there is a chance that you might be able to opt for some other ways of distracting your children during those periods of time. So screen time limits are great, but sometimes they really aren't practical. And there are other treatment strategies. There are eye drops called low-dose atropine. That deserves an entire episode to itself, but it's a compounded drop, meaning mixed specially in a pharmacy. And it's been shown in over 100 studies to be of benefit in children to slow that worsening. Again, it's not going to reverse the nearsightedness, but it'll slow the worsening. There's special contact lenses that kids can wear during the day and throw away at night, daily disposable ones that are a little bit different than the regular contact lenses, even special glasses that are available in other parts of the world that are different than the single vision glasses that we have here in the US that, again, slow the worsening by helping focus the light on the periphery of the retina. And even contact lenses that you sleep in, though I'm not the biggest fan of those, they do help slow nearsightedness down. So a lot of treatments that can be employed by parents, especially if you have a family history of retinal detachments, if you are a high myope, if you have a number that's -6 or above, that increases your risk of vision-threatening eye consequences. And if it's something you don't want for your children, then these are all therapies that you can discuss with your eye doctor and ask them about their familiarity with it and which one they recommend for your child. There's even preventative measures to take to be able to make sure that maybe your child might not even need glasses at all, which is something, again, that really warrants an entire discussion with your eye doctor. But bottom line, it's important for you all to know, to feel empowered that these treatment options exist and to ask your eye doctor about them. There are also a lot of misconceptions about screen time and nearsightedness and just what makes vision worse in children. Blue light glasses. During the pandemic, every kid was on Zoom and they showed With the COVID pandemic, with the distance learning, there was a sharp increase in nearsightedness in kids. They did a study and they followed children for 12 months, and they saw that the younger kids actually had a higher increase in nearsightedness. The kids that were 6 years old had a 3 times increase in the amount of nearsightedness they experienced compared to the 8 to 10-year-olds. They had about a 1.4 times increase, still increase, but not as much. And that's important because it really shows that the younger that kids start on screens, the longer that they're on screens, that impacts their vision. And that's data that we did not have before the pandemic. And it's something to be really mindful of when giving a screen to your child. It's much more consequential to give it to a younger child than to someone that's older. And this is why the American Academy of Pediatrics recommends no screen time other than just video chatting for kids younger than 2. Yep, that means even those educational shows, no screen time. And then from ages 2 to 5 years old, just 1 hour of screen time. And this falls really nicely and supported by the data that shows that safe protective zone of about 1 hour or less really only increased nearsightedness by 5%. Now, if kids are older, then we really recommend that parents sit down with your kids and create a screen time agreement so it doesn't just feel like rules being handed down to children. Make it a collaboration. Make it something that there's buy-in with your kids. There's no hard and fast rules above age 5, but from the data from COVID, we know increased screen time, even in that pivotal 6 to 8 to 10 years old, will increase their risk of nearsightedness. Now, that doesn't necessarily mean it's only screen time. Of course, reading, writing, those are still near work. Anything you're doing up close can increase nearsightedness in children. But this is something that you might be able to cut down a little bit more just by being thoughtful about those intentional choices. But in this season, I'm not just talking about screen time. It might seem like I'm obsessed with nearsightedness and screen time, but we're covering eye health in general because we are trying to raise our children in this online community and be able to empower them to have good vision as well as for you. So I'm going to be discussing kids' eye topics like amblyopia and astigmatism and strabismus, misaligned eyes, lazy eyes, all the things that your child might have been diagnosed with as you went into the eye doctor's office. But I'm also diving into eye health topics for parents too. The fun stuff. Does that lash serum really work and is it good for your eyes? Should you have LASIK? And as we start to look at our parents, how can we advise them about cataract surgery or the types of eye surgeries that they are experiencing? Because that's what many of us are doing. We're in that sandwich generation where we're taking care of our children and also advising our parents. So this season is really going to have a lot for everyone about all the different topics ranging from eye health from babies all the way to grandparents. And just to highlight some of the guests that we're going to be having on this season, I'll be having an LAPD detective who's going to be talking about the dangers of being online as a teen or a tween and what we can do as parents to protect our children. I'll be interviewing a woman who started a nonprofit looking at the toxic images from social media and their impact on body image for teens and tweens. And parenting experts are going to break down everything from technology to increasing your children's resilience and how to be able to get them to buy into these screen time habits without the tantrums. And of course, fellow physicians from all different specialties, rheumatologists, maternal fetal medicine, dermatologists, all to educate how the eyes might actually be a clue as to something else going on in your body, from rheumatologic diseases to pregnancy to all of the different kinds of systemic problems like diabetes can cause in the eyes. I've got you covered. So whether you're a new parent looking at your baby's first upcoming eye appointment, or you are tackling with how to get your tween off of social media, or choosing a cataract surgery lens for your aging parents, this season has something for you. But more than anything, I want this to be a conversation. This is not going to be a dry medical education lecture. So I want to know what your questions, your comments, share your stories with me. Every Thursday on Instagram, I'll have a story with a question and answer box. I would love for you to put those comments and questions into that Q&A box. You can also email me at rupa@drrupawong.com or leave a voice memo. I find that a lot of parents don't necessarily know they themselves have a question unless they hear it by someone else. And this is a great way to incorporate it into our episodes and to really get your questions answered. So you can always leave a voice memo, and the phone number for that is 347-470-1881. Thanks for joining me. I am Dr. Rupa Wong, and this was In Focus. Thanks for joining me on In Focus. If you found today's episode helpful, I'd love for you to share it with a friend, leave a review, or hit that subscribe button so you never miss an episode. For more tips on eye health, parenting, and staying focused in a busy world, follow me on Instagram at Dr. Rupa Wong or head to drrupawong.com. Until next time, keep your vision clear, your priorities focused, and your family thriving.